Hello, my name is Nicholas Lalley. Today I'm going to talk to you about wearable health technology. This is for Info 550. The agenda today. What is wearable technology? The market impact of wearable technology. What is wearable health technology? Overview of health tracker phone apps. History. Importance. SWOT analysis. Future of health tracking. Personal background. How does wearable tech relate to our studies? And then questions for discussion. So what is wearable technology? Wearable technology, wearables, fashionable technology, wearable devices, tech togs, or fashion electronics, are smart electronic devices, which are electronic devices with microcontrollers that can be incorporated into clothing or worn on the body as implants or accessories. In a recent study, 71 of those aged between 16 to 24 wanted to have wearable tech. And you can see the photo above shows the smartwatches, smart glasses, as well as a pager. The market impact of wearable technology. Our y-axis here is total revenue in US dollars in billions. Our x-axis is 2015 to 2026 in years. And you can see this exponential growth starting in 2015 going to 2026. And you can see the impact that wearable technology will have on our market. So what are wearable health devices? Wearable health devices are just wearable technology devices, tech togs, or smart electronic devices that collect data to monitor users' health. 14% of our wearable devices are smart video or photo devices, such as GoPro. 45% of devices that people use are fitness bands. 12% is smart clothing. 27% includes smartwatches, and the 15% is smart glasses. In May of 2018, the most active users on mobile health tracking apps was Fitbit at 27.4 million. MyFitnessPal was a close second at 19.1 million, and then S Health by Samsung was at 14.9 million. I'm going to talk about the history of wearable technologies. In 1286, Emperor Nero would look through an emerald in order to see gladiators fight. This was considered some of the first uses of eyeglasses. In 1510, the Nummerigg egg was the first portable mechanical timekeeping device. And in the 1600s, the Chinese would use the Vasquez ring for calculations. In 1907, cameras were attached to pigeons during World War I in order to capture aerial photographs behind enemy lines. In 1961, mathematicians Thorpe and Shannon built a computer small enough to fit inside a shoe, and the goal was to help them win at roulette. And it would predict the speed and rotation of the ball to determine what numbers it should bet on. In 1963, a pioneer named Gernsback created the TV glasses. He believed a small portable television screen strapped to the face of the user would be the future. In 1975, the Pulsar calculator watch was released. In 1979, the Sony Walkman changed how people would listen to music. In 1981, the Seiko UC 2000 RISC PC was released, which did basic calculations. It wasn't a big hit. In 1984, the Nelsonic Space Attacker watch was released, which was a portable game and allowed them to play Space Invaders on their watch. In 1989, a Private Eye, which was a head-mounted screen handheld input device, which the modern device that it was trying to act like is Google Glass. In the 90s, Sports Illustrated came up with a sneaker phone. It was both a sneaker and a phone. Levi's ICD Plus jacket was released, which allowed a user to integrate his mobile phone, MP3 player, and headphones within the jacket. In 2002, a Bluetooth headset was released, allowing for hand-free calls. In 2006, Nike Plus teamed up with Apple to track pace, time, and distance in calories during a workout. 2008, Fitbit Classic was released, allowing users to track steps taken, distance traveled, calories burned, activity intensity, and sleep. 2013, Google Glasses were released. In 2014, there was a Tommy Hilfiger solar-powered jacket which allowed users to charge their phone. And then in 2014, we saw more activity trackers. In 2015, we saw the release of the Apple Watch, Ringly, which would offer an escape from your phone and would alert users with different vibrations and light displays. Quell would attempt to block signals from the brain to prevent pain. And BPay would allow users to make contactless payments via personalized wristband. 2015 to 2016 was the release of Oculus Rift, which allowed for virtual reality to be widely accessed. The wearable health devices allows for individuals to track personal health data that can encourage people to record, monitor, track, and trend their health conditions. It can encourage people to take control of their health and improve their lifestyle. And devices can also record and analyze state of diseases or biological changes. We'll start our SWOT analysis with strengths. It will keep users more engaged about health. There's potential to improve consumer value of life, more in-depth analysis about health conditions. It could involve less invasive techniques and less invasive treatment. And there could be long-term cost savings with using wearable technology. There has been reports of 61% of British and American wearable tech users felt more informed about their medical conditions and medical state. 82% of wearable tech users felt it enhanced their lives. 88% of physicians want patients to monitor health parameters at home, and then another 88% potential cost savings with the using biometric devices to monitor patients with serious conditions. Continue our SWOT analysis with weaknesses. So some of the weaknesses are that majority of devices need charging. Specialized devices can be pretty expensive. Data can be misleading or inaccurate. Potential for false positive and false negatives. And you can see the comic on the right. Great news, you're pregnant. And they're saying that to that overweight gentleman sitting on the bench. That would be a false positive. Unfortunately, with wearable technology and non-invasive medicine, false positives and false negatives are more likely to occur. And then it's also going to increase demand on physicians. Now that people can take more data about their health, they're going to have more questions and more concerns about their well-being. So physicians will have to learn what this wearable tech is measuring and how they can help them on their personal health journey. Your SWOT analysis with opportunities. These personalized health devices create more opportunities for personalized healthcare. It will no longer be a one-size-fits-all, whereas you may start creating an individualized plan with your doctor to become more healthy. It will also generate greater amounts of data for researchers to find cures and treatments for diseases. There's also an opportunity to connect to the Internet of Things, to modify your surroundings based on your health data. So if you're stressed out, you can train your health device to play music to calm you down. Or if you're tired and it's late at night, for the lights to start to dim so you slowly drift off into sleep. Doing our SWOT analysis with threats, current HIPAA laws and regulations, cybersecurity and potential compromises to personal health data, privacy concerns, such as corporations trying to monitor and track employees with these health devices, and potential increased discrimination by health insurance companies and other corporations trying to track and trend and use existing genetics or health information of the consumer. Devices. So I have below 12 images of 12 interesting devices. There is much more out there and there will be much more to come. But in the top left is Smart Stop. It monitors those who are trying to quit smoking's biological signs and data, and it will inject nicotine when one craves nicotine the most. Lung cancer detection. It's a watch that will be able to detect lung cancer in early stages to prevent development and prevent lung cancer from happening. There's also lenses that can be used with virtual reality to have a hybrid of virtual reality and the real world. And also they could be used for cameras in the future. There will be breast cancer detecting bras. Simi created a hormone detection for women's health. There's exoskeletons helping with mobile issues. Arya created a guide for the blind. They can put on glasses and receive instructions from technicians guiding the blinds. There's also UV sensors. Outlet created wearable tech for babies, monitoring their health. There's bionic eyes, cochlea implants, and hearing aids. And they also have circuit tattoos where they could put conductive ink in the form of tattoo and create different circuits. To share why I chose this topic because of my personal background. I graduated from the University of Cincinnati with a master's degree in electrical engineering. My systems track focused on biomedical microsystems. So I got to experiment with a lot of different topics. So one topic was sweat-based sensors where we could monitor the chemical breakdown of sweat and determine the health of a patient by their sweat. It was a non-invasive technique that didn't have to draw blood. Lab on a chip was similar. You could take small amounts of blood or sweat or data, and it could determine the analysis of if someone had HIV by one drop or a couple drops of blood. Microelectric machinery systems, how are we going to create circuitry that small to power these labs on the chips, to power our wearable technology devices? And then lastly, nanotechnology-based thermoelectric materials. How are we going to power these electronics? Could we use the heat coming off the human body to power them? So there's a lot of interesting topics, especially in science within this field of study. So that's why I chose this topic. Health technology and wearable technology definitely relate to the course topics. As Dr. Crable stated, 40% of the Internet of Things will be health related by 2020. Wearable technology cybersecurity will be a major focus in the future. Health data will be used as an asset to the individual, researchers, and medical professionals. And there's also potential to use personalized health records with medical health records. Eventually, we'll be able to use personalized health records with the help of algorithms to monitor and trend our health data and hopefully predict the future and how we can improve our individual health. Supplemental videos. Carrie from Mythbusters is controlling a cockroach using an app. There's also a TED Talk on controlling someone else's arm with your brain. That's an excellent one. There's also another GE produced video called The Invisible Bike Helmet, which is another great wearable tech that's out there. And then Intel has a video called Make It Wearable. I'd recommend watching all of these. Questions for the class. Does anyone own a wearable health tracker or wearable technology? What qualities do you like about the wearable tech? What qualities don't you like about your wearable tech? Does it improve your quality of life? What predictions do you have for the future of wearable tech? What devices and sensors would you like to see incorporated into wearable technology? Do you have any ethical concerns about wearable technology? And do you think wearable technology will help encourage a bridge between electronic medical records and personal health records? Here is the works consulted. For watching my video on wearable health technologies. I look forward to your comments, insights, and discussions about wearable health technologies.